Humerus. The humerus is the longest bone of the upper limb. Side determination. The upper end is rounded to form the head. The lower end is expanded from side to side and flattened from before backwards. The head is directed medially, upwards and backwards. The lesser tubercle projects from the front of the upper end and is limited laterally by the intertubercular sulcus or the bicipital groove. Features of the humerus. First, let's see the head of the humerus. The head is directed medially, backwards and upwards. It articulates with the glenoid cavity of the scapula. The head forms 1/3 of a sphere and is larger than the glenoid cavity. Then we have the anatomical neck. It separates the head from the rest of the upper end of the humerus. The surgical neck separates the upper end from the shaft. Then we have the morphological neck. It lies 0.5 cm below the surgical neck. It shows the position of the epiphyseal line. Then we have the greater tubercle, which is an elevation on the lateral part of the upper end of the humerus. The lesser tubercle is an elevation on the anterior aspect of the upper end of the humerus. The intertubercular sulcus separates the lesser tubercle from the greater tubercle. Lower end of the humerus. We have the lateral epicondyle, which is smaller than the medial epicondyle. The medial epicondyle is easily felt on the medial side of the elbow. Then we have the capitulum, which is a rounded projection and it articulates with the head of the radius. Then the trochlea, which is a pulley-shaped surface and it articulates with the trochlear notch of the ulna. The medial edge of the trochlea projects down 6 mm more than the lateral edge to form the carrying angle. Then we have the radial fossa and the coronoid fossa. The radial fossa is a depression just above the capitulum. It accommodates with the head of the radius when the elbow is flexed. The coronoid fossa is a depression just above the trochlea. It accommodates with the coronoid process of the ulna when the elbow is flexed. Posteriorly, we have the olecranon fossa, which lies above the posterior aspect of the trochlea. It accommodates with the olecranon process of the ulna when the elbow is extended. Shaft of the humerus. The shaft is rounded in the upper half and triangular in the lower half. First we have the lateral border. The lower end forms the lateral supracondylar ridge. In the medial border, it forms the medial lip of the intertubercular sulcus. It continues below with the medial supracondylar ridge. Then we have the anterior border in the upper 1/3, which forms the lateral lip of the intertubercular sulcus. The middle forms the anterior margin of the deltoid tuberosity. And the nutrient foramen. Surfaces of the humerus. We have the anterolateral surface, anteromedial surface and the posterior surface. The first one is the anterolateral surface. It lies between the anterior and the lateral borders. The deltoid tuberosity is a V-shaped triangular surface. The radial groove runs downwards and forwards. Then the anteromedial surface. The anteromedial surface lies between the anterior and the medial borders. Nutrient foramen is seen near the medial border. Thirdly, we have the posterior surface. It lies between the medial and the lateral border. Its upper part has an oblique ridge. The middle 1/3 is crossed by the radial groove. Attachments of the humerus. Anteriorly, we have the supraspinatus, the subscapularis, the deltoid, medial head of the triceps brachii, the coracobrachialis, the brachialis, brachioradialis, extensa carpi radialis longus, and the pronator teres. In the posterior view, we have the supraspinatus, infraspinatus, teres minor, triceps brachii, that is the lateral head, deltoid, brachialis, medial head of the triceps brachii, and the anconeus muscle. Clinical anatomy of the humerus. The common sites of fracture of the humerus are the surgical neck, the shaft, and the supracondylar region. Supracondylar fracture is common in young age, caused by a fall on the outstretched hand. The lower fragment is displaced backwards so that the elbow is unduly prominent. This causes injury to the median nerve and may lead to Volkmann's ischemic contracture due to occlusion of the brachial artery. The humerus has a poor blood supply at the junction of its upper one-third and lower two-third. The head of the humerus commonly dislocates inferiorly.